Okay. Hi, everyone. Welcome to the Q&A with Nannies on Call and our Nannies on Call experts. I'm Michelle Kelsey. I'm the founder of Nannies on Call, and I'm joined by Lisa and Kate, who will be answering all the questions that were sent in. So we'll just go through a couple of housekeeping items to help everyone. If you're on, well, I guess I'll start in my list. Thanks for joining us. And if you don't know about Nannies on Call, we're an agency that's been around since 2001. And we provide high-end educated nannies to families that focus on childcare. We provide on-call babysitting as well as full-time, part-time, and temporary nannies. So we run the gamut of everything you might need in terms of having a nanny in your home. And we know there's a lot of concern right now around COVID and having people in your home, so we're going to try and answer a lot of those questions. If you haven't used Zoom too much before and are on the video, it's going to be going between me and Lisa and Kate talking. And so if you go up to the upper right-hand corner, there should be a section that says speaker view. And so whoever's talking then will be the main person on your screen, so it might be easier to follow. We're thinking we'll spend about 30 to 45 minutes answering the questions that came in. There are quite a lot, so hopefully we'll get through all of them. And then we'll spend the rest of the time answering questions that you might have that come up during this chat. So if you do have a question, down in the bottom center of your screen is a chat button. Feel free to enter any questions you have. Whenever they come up, that's fine. And we'll try and get to those questions at the end if there's any additional questions that do come up or things we don't answer fully for you. But feel free to enter those chat questions in anytime you think of them, and I'll get to them at the end. They can be non-COVID related as well. Just remember, we are focusing on COVID today because that's what the questions were that came in, but they certainly don't have to be. If you have other general nanny questions that you need help with, we're happy to answer those as well. We just want to mention we are not lawyers, accountants, or healthcare professionals. We are a nanny agency. We know a lot about a lot of the different areas of those, but before you make any major decisions, if it has to do with legal or accounting, you should check with a lawyer and accountant. And we do recommend you look at your health regulations in your province because they do differ between each province. We also want to remind you that the advice we're giving is valid as of today. Everything is changing so quickly in the world that tomorrow or next week, this advice could be totally different. And just remember that as you move forward, it might change. And I think I mentioned in the very beginning, a few people emailed. We had over 30 people registered and we only have a few people actually on the call, which is fine because we are recording it. And then I will email it out tomorrow, later today or tomorrow, whenever the recording becomes available to me. And you can watch it again, share it with friends, and all the people who couldn't make it can watch it whenever they have time, because I understand it's also in the middle of the workday. And without further ado, I'll just introduce Lisa and Kate, just a quick little introduction. So Lisa Bruce lives in BC. She's the one waving with the star and the rainbow behind her. She's the mother of 2 school-age children, so she completely understands what everyone's going through. She's working a full-time job and taking care of her kids and has her husband working at home, so she's right in there with everyone. She's been working for Nannies on Call for over 13 years, and she's helped thousands of families find fantastic nannies and helped lots of nannies with any issues that they had in their jobs or trying to find jobs. So she's really well-versed in all things nanny. And next is Kate McGeachin. She's below, well, for me, I guess she's below Lisa. And she is in Ontario, and she has been working for Nannies on Call about 11 or 12 years. Lisa's probably 13 or 14. Kate's 11 or 12. Before she worked for Nannies on Call, she actually worked for another agency in the UK. So her level of understanding of childcare and nanny services is very deep. She's also obviously helped thousands of families. She has 2 elementary school age girls, and her husband are also working from home, so she also understands juggling everything that's going on during this time. She also works full-time, so she's doing her best with even younger kids. She is the youngest kids out of Lisa, Kate, and I. So she knows what you're going through. And then finally, I'm Michelle. I founded Nannies on Call in 2001. My kids are now older. I have a 21 and a 24-year-old. So although I'm not quite juggling having kids at home and schooling, I still am juggling as they both still live at home. And I've been running the agency and overseeing all the placements and nannies the whole time. So I'm very involved in all the day-to-day. So without further ado, we'll get to all the questions you sent in. And I think we're just going to go back and forth between Lisa and Kate, and they'll answer your questions, and we'll just pipe up if there's anything else that comes up. Okay, so Lisa, this one, we'll start with you. I'm in self-isolation. Alberta Health advised me not to have my employee, so her nanny, come to work. I assume I still have to pay her. Is there a subsidy available?
Okay, that's a really good question, and it's on a lot of people's minds. You actually don't need to pay them if you were advised not to have them come into work. You can either let her go or lay her off, and so the difference would be whether or not you think that they're going to be coming back. So when you're laying somebody off, you would need to be paying out any sort of. Hello?
Yeah, you're there.
Oh, I just disappeared for a second. Sorry. If you're laying them off, then you would need to pay out any vacation that's been accrued and give them a record of employment. And so that what would happen is the nanny would take the record of employment and they can apply for the CERB benefit. And currently the CERB benefit, I believe, is running until the end of November. And they would receive $2,000 a month from the government. And then at that point, once their CERB benefit is about to run out, if you decide that you are not going to have your nanny come back, maybe your situation has changed, maybe you found a spot in daycare, whatever that is, then at that point, then you would let your nanny go. And depending on how long they've been with you, you may need to pay some sort of a severance to them.
Great. Okay. Kate. My employee is going to the US for a social distancing family gathering, her wedding. How do I handle that? Which is a huge question that, comes up all the time.
I mean, that's a really tricky one simply because of the situation in the States right now, just with the really high numbers. I mean, you don't have to give her that time off. Under normal circumstances, pre-COVID, I certainly would recommend that you do give her the time off. I suppose what you need to bear in mind is that she needs to self-quarantine when she comes back. And then you need to figure out if that time is going to be paid or if it's going to be unpaid. So, assuming she's taking 1 week off for the wedding and she's coming back to Canada and needs to self-quarantine for 2 weeks, that's 3 weeks of vacation. Has she accrued that much vacation? Do you want to pay her for that time? Do you want to pay her for part of that time? It's certainly not unheard of for nannies to receive 3 weeks of paid vacation. So, if you value her and you love her, I would recommend that you pay her for that. But at the end of the day, really, it's a question of your relationship and how long she's been employed in your family.
Right. And it's true for all employees. Ultimately, the nanny employer relationship is a unique one because they're in your home, but certainly with vacation and vacation accrual, as employers, you are not required to give them the time off that they ask for. You're required to give them their 2 weeks or whatever they've accrued, but you can say no to the timing or the length of time. If they ask for 3 weeks and you can't give them 3 weeks because you need them, you can say no to 3 weeks. Yeah. Okay.
That's a tricky one.
It is a tricky one, especially right now. But I think right now, the hardest part right now is if you do choose to leave Canada, coming back in, you do have to self-isolate for 2 weeks, which makes your vacation incredibly long. Yeah. Okay, Kate, this is a really long one. And I know you have all the questions in front of you too, but I'll ask it so everyone can hear it. What can we legally ask our nannies to do to ensure they minimize the risk of getting and transmitting COVID to our family? Is it legal for us to ask the following from them, including and include it in the employment contract? Practice physical distancing while not in our home, wearing a mask on transit, also wearing a mask in our home, following other recommended safety and health protocols, sorry, I'm just going to let that person in. Change from the outside to their outside clothes to a new set of clothes when they get in, following our house safety and hygiene protocols, such as temperature checks, daily health checks, info sheets, sanitizing shoes. It's a big question, but it's the question I think every single client asks us when they call to find out about a nanny. So I think you have those questions in front of you, so maybe you can just break them down individually.
Yeah, so practicing physical distancing while not in the home, wearing a mask while in transit. I feel like you can ask that. There's no legal implications if they don't follow it, but you can certainly ask them to. Most nannies are following the guidelines laid out by the province and by public health. You know, I've spoken to so many nannies, and I can tell you that they're all abiding by the rules. Changing from outside to new set of clothes when they arrive, yeah, I think that's perfectly reasonable. I think most nannies would do that anyway in their own home. If they were coming home, they would change. And we have that for lots of various reasons as well. You know, whether a child has allergies or, you know, whatever it may be. Following our health safety and hygiene protocols, such as temperature check, daily health check, info sheets, and sanitizing shoes. I haven't had any families ask for those types of requests. I think what it comes down to is a question of, is it reasonable? Just as an example, a few weeks ago, I placed a nanny with a family, and the nanny wanted me to negotiate a paid Uber back and forth to work. And I'll tell you, it was pricey. She didn't live that close. It was definitely, you know, it was expensive. And so the mom thought, well, if I'm paying this much money for my nanny to get back and forth to work, I don't think it's fair then that she takes transit in the evenings and on weekends. And I thought that that was reasonable. And so we wrote it in the contract. The nanny agreed to it, no problem. And so that is reasonable. If, you know, most people now are in phase 3, if you're still asking the nanny, you know, not to leave the house, not to go to the grocery store, not to see any friends or family, I don't know how reasonable that is anymore. I think back in April, it was certainly reasonable. Time changing.
Yeah, and Kate, it sounds like a lot of it has to do with communication and negotiating upfront about what your family is comfortable with, and then also what the nanny is comfortable with. Because in some cases, maybe the family, we work with a lot of families who are doctors or frontline workers, and so nannies need to be aware of what their risk is as well.
Yeah, absolutely. And everybody's circumstance is different. You know, you may have an immunocompromised family member, you may live with your grandma, you know, you may live by yourself and be perfectly fit and healthy. I mean, everybody's situation is different, and it's just, you need to communicate openly every single day with your nanny, your fears, their fears, you know, what the circumstances are.
Okay, great.
Yes, and it needs to be a two-way street too, is something I wanted to add in. It needs to be, if you're asking your nanny to do all these things, then it should be, you know, reciprocated.
Yeah,
right.
Absolutely.
Family and the nanny are both following the same guidelines.
Right.
Yeah. Okay. Lisa, another question that we're getting every day and was also sent in is, given that we do not have a vaccine or community immunity yet for COVID, how do we deal and include sick days in the contract?
Again, a really good question, and it's a bit of a tricky one. It's something that we kind of go back and forth on too. It is industry standard in the nanny world that you would pay your nanny for sick days. That's what we suggest. And that's mostly because usually you're working with sick children. That's why a lot of parents will choose having a nanny come into their home rather than going into a daycare center.
And Lisa, pre-COVID, how many days were you generally recommending?
You know, I don't normally put a number to it. What we do in our contract is we would say, you know, the paid sick days are at the discretion of the parents, because unfortunately there are some people that will take advantage of that. Back in the day, I used to suggest for a full-time placement anywhere between 3 to 7 paid sick days per year, which I think is pretty average in most, not even just in the nanny world, but I think in most, you know, jobs that you go to every day. So the way that we have it lined up is paid sick days are at the discretion, but we encourage all of our families to pay their nanny for when they're not needed. Now, if there's some sort of abuse going on with, you know, hey, I didn't take any sick days, I'm going to go to the beach, and you know that, that's a little different. But during COVID, again, like touching on what Kate had said, we really encourage that you discuss with your nanny your comfort level. If anybody's feeling any sort of sickness, you have to make sure you communicate. Again, we're going to keep saying the word communicate with your nanny. You know, you have to alert each other that if they're feeling any symptoms. But at this point, there's no legal requirement. I know that there was some talk about it, but I don't think anything's been implemented. But again, you might need to check back because things are changing all the time.
Right.
Yeah.
And we'll keep going on the sickness question because there were a couple others related to it. When a nanny is sick, regardless of whether it's COVID or not, can we advise the nanny to skip work or avoid transmission of the virus, of any virus, not just COVID? And my understanding is that based on employment standards, you get 3 unpaid sick leave, but I know there has been petition to have it paid. So you kind of just covered that, but can they ask them not to come in to work if they're feeling at all sick?
They absolutely can, but be prepared that you would need to pay your nanny. So again, going back to the industry standard, nannies are looking for guaranteed number of hours. If they're committing to your family, you can't tell them, oh, by the way, I don't need to come in today or tomorrow because, you know, little Sally has a fever. You can ask them to not come in, but be prepared that you need to pay them. It's not like they can easily just go and find work elsewhere. They're banking on that income as well.
Mm-hmm.
And then with the part about the 3 unpaid sick days, it really depends on what province you're in. For example, in Alberta, you can take up to 5 unpaid personal or sick days, and that includes caring for somebody else in your family, a child, grandmother, parent, somebody that lives with you. And in Ontario and BC, it's 3 unpaid sick days. So that's the only like numbers that I know of right now. But again, just be prepared to pay them if you're asking them not to come in.
Right. And that actually goes to the next question, which is on the flip side, and you kind of covered it, if someone in their household is sick, can they ask the nanny not to come in? Which you basically said, of course they can.
Yeah, but again, just being prepared to pay them their guaranteed number of hours.
Right.
If you want them to stick around.
Right.
Yeah.
Okay. And we'll go back to Lisa again. It says, if it does, and we get the advice from the BC Health Authority or government to stay home lockdown, can we keep employing the nanny given that the nanny also wants to continue working as well? So if we go into a second, I think at this point, it would be a second wave.
Right. Unfortunately, I don't know the answer to that. I think it's really going to be dependent again on what the rules are at the time. And as we've said a few times now, they're ever changing. In the beginning, when this first COVID thing hit, if somebody wasn't in your bubble, then no, they weren't allowed to have them come in. That's, I think, why we saw so many people being laid off. It was not allowed. But there's new information that's coming out all the time, and that can certainly change,
Right.
you know.
And I would also say that often it's been very confusing to employ nannies because during the lockdown at the very beginning, it wasn't actually clear if you were allowed to have nannies in your home in some of the provinces. Some of the provinces actually listed nannies, but not all of them did. And so at Nannies on Call, we followed the protocols of daycare. So we followed what other childcare professionals were doing in terms of allowing or not allowing, even though nannies were not named in some of the list of essential services. So that's how we did it.
Yeah.
What are some things that people should consider including in an employment contract when the second wave hits, i.e. temporary layoffs, termination, etc.?
So going back to sick days, I think that's something that you'd want to lay out, but just be mindful of the fact that if there's a second wave, that there may be rules that are implemented at that time. So you'll have to make sure that you're really staying on top of what each province or what province you're living in is stating as the new rule, if you will. Make sure that you're adding in make sure that if you're adding in something about layoffs or termination, that it abides by employment standards. Because even if you have something in a contract, employment standards will trump whatever you've written if it's in the now. Like if it's something that they've implemented 6 months later type thing. So you just have to make sure that you're mindful of what the rules are, what the employment standard says, and know the rules, I guess, for each province, because it might be waived.
And the reality is you can lay off or fire a nanny at any time due to your situation, COVID or unrelated. You just have to follow those employment standards laws, which have to do with paying out their accrued vacation and severance. So that can be done at any time.
Yeah. So. Yeah, exactly.
But you do want to think about it if you think you want your nanny to come back, or how you want to treat her moving forward. Her or him. We only place a few males. So that's why we use her all the time. But we do place a few males, to be fair.
Yeah.
If we decide if we decide to have the nanny skip work until the kids are well, should we follow the 14-day isolation rule? And are we legally responsible paid for the nanny? So we kind of already did answer that, but maybe you can say, should they follow 14-day?
Yeah, so you should definitely follow all of the isolation rules that are put in place at the time. My understanding is it's currently 10 days. The only thing that you would be doing the 14-day would be when you're coming back from a trip. So it's 10 days currently for the isolation, and you should definitely be paying your nanny when you're not asking them to come in, even prior to COVID. As I mentioned, your guaranteed number of hours are important.
Right. Okay.
I had this situation just a few days ago, and so the child was unwell. So the parents and the 2 children in the family went and got tested. All the tests were negative, and then the nanny went back to work. So it was only I think she was only off for 3 days while they waited for the results, but she was paid for those 3 days.
Okay, great. Okay, Kate, given that families are considered employers, are there any specific, this one's obviously from BC, WorkSafe BC guidelines, insurance updates, costs for nannies or employers? It actually goes to all provinces, whether it's WorkSafe BC or not.
Yeah, so this is a question regarding workers' compensation. So, if nanny's injured at work, if she falls down the stairs, breaks a leg, that sort of thing, that's what that insurance covers. It is mandatory in all provinces apart from Alberta. Alberta, you do not need to purchase it for your nanny. But I haven't heard of any increases since COVID hit. I don't believe that they have increased it. I recommend that you check out the websites or call the worker compensation board directly to get a definitive answer. But as far as I'm aware, nothing has changed.
Okay, great. Lisa, this is maybe not so COVID related, but maybe more people are concerned about it right now. Are we legally okay to install nanny baby monitors in our home as long as the nanny is aware from the start? Should it also be in the written agreement?
So if you do decide that you're going to install nanny cameras or baby monitors in the home, then yes, absolutely, it should be put in the contract. In fact, our contracts that we drop do have a spot now that states that if the family decides that they're going to have cameras, or they do, that the nanny is aware of them. It's a really tricky question though, because I think it's really hard for some nannies. It almost feels like you're not trusting them when you have them installed. And it's important that if you do, for whatever reason, that you are letting them know ahead of time. Otherwise, if you're not upfront with them right from the beginning and they find out about it, it breaks the lines of trust for sure. And I've had that happen before. I had a nanny, it wasn't super recent, but I had a nanny that didn't know that the family had cameras. And one day, parents came home, mom said to the nanny, I'd like to ask you to please stop drinking coffee in the living room from now on, only in the kitchen, please. And the nanny was like, okay, yeah, okay, fine. And then she thought about it some more after, and she's like, well, how did they know that I was drinking coffee in the living room? Not that I was trying to hide it, but I had no idea that was one of their family rules or home rules. And so she asked the next day, And the family confirmed that, yeah, they have monitors in the entire house except for the bathroom. And the nanny, it wasn't like she had been there just for a couple of weeks or anything like that. She had been there for a while, and she ended up quitting after that because she just couldn't get over that yucky feeling of, what else are they not telling me? You know, she didn't like that. So it's just one of those things too. If you're, just be upfront about it at first. Make sure you're not hiding it. And yes, you should definitely put it into the contract so that everybody's on the same page.
Right. Great. Kate, have nanny rates changed as a result of COVID? The person specifically who was asking is in Calgary, but we have seen it across the board. So, yeah.
I would say yes. I would say that they have changed. Nannies, I mean, good nannies are always in really high demand, and especially so right now. You know, parents are choosing not to send their kids to daycare. You know, who knows what will happen in September with the school-age kids. So the demand for quality nannies right now is higher than it's ever been. You know, jobs that were one baby and you know, 2 working parents have now become 1 baby, parents at home, and 2 older kids as well. So there's a lot more added responsibility that goes on, and I think that needs to be taken into consideration. And it becomes a game of supply and demand. You know, the nannies with the qualifications they're receiving multiple offers right now, and it's only human nature to accept, you know, a higher pay. And so I would say that they definitely have increased.
Yeah, I agree too. Absolutely.
Yeah. Okay. Lisa, what obligations do we have as employers within our home to ensure the safety of our nanny?
Really, you need to make sure that you're following all the government regulations for your province. In your specific home, make sure that you're, you know, again, talking to your nanny about what your expectations are and the rules are for your home. You know, if you're looking for things like, I want my nanny to wear gloves, you should be providing the gloves. If you want them to sanitize their hands as soon as they walk in the door, maybe have that extra bottle of sanitizer right beside the door, which I think probably most people do. So basically just making sure that you're supplying the things that you're implementing into your family rules, I guess, if you will. And like we touched on earlier too, if you're asking your nanny to limit interactions with people or not doing things, make sure that you're also reciprocating that, doing the same thing. I recently had a phone call from a nanny who was really upset because the family had all these rules in place. They had drawn up an amendment to their original contract and added in all the COVID clauses and things like that, which is great that they did that. But they were not practicing the same thing. And I said, well, what do you mean? And she says, well, Dad called and said he was going to be late. He was going to the pub with his friends. And it was strictly in their contract that there were no social interactions outside of their family bubbles. And so she was really ticked off about that, unfortunately. Yeah. So I asked her to go and talk to them. And when she did talk to them, everything smoothed over. They didn't really think about it in the terms of the nanny as well. And I think that's really important, is you have to put yourself in their shoes also. Yeah.
Yeah. Okay. That's great. Okay, so we do have a few more questions. I just wanted to stop maybe and see if anyone who's on the call right now had any questions or needed clarification on anything specific. Again, we had almost 40 people sign up and not very many people are on the call, which is okay because maybe they're just waiting for the response. So if you are on the call and you do have a question, feel free to maybe unmute yourself and just ask it, or we'll just keep on going through some of these additional questions. Does anyone have any questions? Sorry, I'm looking around at my second monitor to see the list of people. No? Okay, well, we'll just keep going with the questions we have already prearranged. And if you do think of something, please do let us know. I don't have these ones marked for Lisa or Kate, so we'll just, you guys can jump in. Can I assume I can ask my nanny to work solely for my family, even though I only need her part-time?
You want me to take this one, Kate?
Sure.
Sure.
No, you can't. I guess the only way that that would work is if they are collecting the CERB benefit, for example. You can make up to $1,000 a month to still be able to collect that. So, I mean, I know there's been a couple of situations at Nannies on Call where a nanny is just working, 8 hours a week type thing for one family. Then I think in that case you could. But I've had a lot of conversations with people as of lately with this question come up time and time again of, because I'm home, I don't necessarily need the same hours that I once did. I only need my nanny for, 2 days instead of 4. But I don't want them working for anybody else. That's really hard because how is the nanny supposed to pay their own bills? They have rent, they have car payments, they've got food, all that. And so it's unfair to ask that. They're not going to be able to survive and they're not going to stick around. They're going to find somebody that will pay them for the full time.
Right.
Yeah.
Okay. So I think Kate, you can maybe talk a little bit more about this. You kind of touched on it already in one of the questions, but how will my nanny get to work? I don't want her taking transit, which is, we hear that constantly right now.
Mm-hmm. Yeah, actually, I would say almost the number one criteria at the moment. What we are seeing is that the parents are picking up the nanny in the morning and dropping her off in the afternoon. Some of them are paying for Ubers or taxis. I have a few families who have leased cars for the nanny. So, she can drive herself to get back and forth to work. A lot of our nannies have driver's licenses in their car. And so they're just driving. If it's right in the heart of the city and there's no parking, the parents are paying for the parking. And then some nannies are just choosing to leave a little bit earlier, enjoying the summer, walking to work, walking home, biking. But of course that will change as the weather turns, in which case then I would encourage them to look at leasing cars, Ubers, that sort of thing.
Right. And one thing to keep in mind is if you are looking for a nanny who does drive and has a car, they are quite a bit more expensive than the nannies who don't.
Yes, exactly.
So is it okay to ask my nanny to do extra duties that were not part of their original contract? I'm working from home and it can be a bit more hands-on with my children. So we are finding this a lot where families are home. I know Lisa and Kate are both working from rooms in their homes now. I'm in my living room. So families are juggling, kind of spending some time with their kids and working. So that leaves some extra time for nannies to do other things that normally they wouldn't have time for.
Yeah. I think the number one thing here is you have to make sure that you guys can come up with a plan together of the things that you're asking that the nanny's comfortable with. So if all of a sudden, especially talking about nannies on call nannies, they're child focused for the most part. They don't want to be scrubbing toilets and washing floors. Their main concern is the children. But if you come up with something like maybe your nanny loves to cook and you're like, for that last hour of the day, would you mind doing family meal preparation? Or would you mind doing my online grocery order? And if the nanny is happy to do so, perfect. Just make sure you put it into like an amendment into your contract, that there is a change and that you've agreed upon it, just so that there's no concern after of like if the nanny starts to find that things are piling up more than what she was used to, that you can sit down and talk about and say, look, this is what we agreed upon. And I do see that it is a bit of a struggle and it's too much. We can, again, communication. Mm-hmm. Communication is key.
Yeah. Okay. So when I interview a prospective nanny, is it acceptable to ask about the nanny's personal living situation? For example, who does she live with? Has she been social distancing at the time of the interview? Kate?
Yeah, I think those are reasonable questions. And they certainly are being asked at the interviews. Right now, through Nannies on Call, all the initial interviews are done via Zoom. And then if the interview goes well, then we're encouraging them to meet face-to-face in the backyard or at a playground or something like that. But I think it is reasonable. We also at the agency ask the nanny's situation, and when we send the resume to the family, we let them know. If the nanny's living by herself, or if her husband's working outside of the home, if he's on the front line, we're certainly divulging as much information as we have. But really what we're finding is that the nannies are just as concerned about the virus as you are. And so they have equally the same questions. Are you working in a hospital? Are you working in the front lines? Are you a police officer? They're asking the questions as well. And I do think that the two-way conversation has to be had during that initial interview.
Right. Definitely.
Yeah.
Okay. This is a big one because we've seen a big shift in the amount of families working from home. So since I'm working from home now, I really only need my nanny in the morning since my baby naps in the afternoon. Can I reduce her hours?
Yeah, we do get a lot of requests with this question. I would say it's not enough for hours for them, and they're going to probably be forced to find something else. Usually when I get asked that question, I would suggest, as we talked about earlier, with maybe bringing on a few different projects to the job. So if you want somebody that's going to do family laundry or family meal preparation, does your groceries for you, that sort of thing. So try to give more hours if you can. And again, you have to be in agreement that those are things that they're willing to do. But yeah, I mean, long story short, you can't reduce hours and expect somebody to stick around, unfortunately, because it's just, they have bills. They have bills to pay.
Yeah. And we have placed in the past a lot of household managers, which is kind of what this gets into, where a nanny's taking on more roles than just the childcare. And so it's important to just start thinking about the nanny role like that if you are working from home. And you don't need the nanny full time to take care of your children because you're spending more time with your children, but you do need help. Parents are stretched very thin. So you got to think about where you need help and where maybe the nanny can help out. It's been a big shift for nannies as well, I would say. They've gone from working in homes with the children on their own without a lot of supervision to having parents around all the time. So it has been a big shift on both sides. So, yeah. What time is it? Okay, we have a little more time. My husband and I are working from home, so we need a nanny 40 hours a week. However, when our office is reopened, we'll need her work 50 hours per week. Says, can you help us? But how would you handle that?
Yeah, so I suppose if the nanny was working for you before COVID hit, she would be used to the 50-hour work week. In which case I would assume that she would be happy to go back to the 50-hour work week. If she was hired recently at 40 hours and you haven't had that discussion yet that you're going to want her to go to 50 hours, I would have it today. I typically find that the nannies are used to the very long hours. If you're two working parents who are working 40 hours a week out of the home, the nanny also needs to cover your commutes to the office. So 50-hour work weeks are very typical. But I would check with her, because if she's got kids of her own, or if she, I don't know, teaches yoga in the evening or something like that, then, and it'll impact that, then it may not be for her, and you may be find yourself looking for a nanny. One in mind is that nannies are due overtime. Depending on the province, there's different overtime rules, but typically it's over 40 or 44 hours a week, in which case then she's due time and a half for the additional hours. And again, what I find generally is that the nannies are grateful for the extra income, and it shouldn't be a problem, but it may be a problem.
Okay.
Yeah.
Again, back to communication.
Yeah. I was just also going to comment too. I think when we're talking about the 40 hours jumping up to 50 is probably less of an issue for most than it would be if you all of a sudden said, I want, I need you for 20 hours, and then all of a sudden I need you for 50, or vice versa. That's going to be a lot trickier to sell that to your nanny, because almost any time that somebody's working 20 hours, they have another job, because people need that income on a full-time. Yeah.
Okay. So this is something we dealt with a lot. Kate and Lisa and I were extremely busy when COVID first struck with calls from families. So this one really plays into that. If there's a second wave and I want my nanny to self-isolate in our home, we have a room in our basement. How does that work?
Yeah, so we did do a bit of this, or we thought that there was a lot of inquiries for somebody to do this. What we have to be mindful of in the live out world is that these nannies have homes of their own. Whether they've got a family of their own or they live on their own, they still have rent to pay or a mortgage to pay, car payments, all that kind of stuff. They're not used to being a live-in nanny. I think that's one of the big things as well, is that it's very different than, being able to go home at 5 and doing whatever you want to do at 5. So it's possible, but we didn't have a ton of success with it. I mean, we did have some families that hired live-in nannies, but on a temporary basis. And also too, the other thing to be mindful of is that you need to pay a live-out wage because they have these bills, and because you may only be looking for somebody to move in for 3 months. It's not it's not acceptable to say, oh, by the way, I'm going to take off this for room and board, because they still have to pay their own rent or their own mortgage. So it's not really all that likely that the nannies are going to be wanting to do that, especially for long term.
And I think we found a lot of the families who did want the nannies to move in with them, although initially they did it for the right reasons of trying to protect themselves from COVID and have everyone self-isolate in the same household. Ultimately, there were a lot of boundaries that were broken because they weren't used to having live-in nannies, and these nannies ended up working kind of constantly. Live-in nannies are used to live-in nannies, and families who have places for live-in nannies are used to different kind of regulations, and I mean, same regulations, but they're just used to having live-in nannies, whereas people who are used to having live-out nannies didn't transition well to the live-in program, basically.
Yeah, those lines get blurred when you all of a sudden have this person around, and well, why wouldn't you help me with bath time even though you're off 2 hours ago? So.
And sometimes the houses aren't set up so well. It's just a spare bedroom upstairs with the rest of the family. It's not separated as much as maybe a live-in situation if you had a full-time live-in nanny. So, okay. Okay, so the live-in home learning. So we don't know what's happening going back to school in September yet. We're all hoping, Lisa and Kate have school-age children. They're hoping to find out as soon as possible if their kids will be going back to school. But we are getting a lot of requests for in-home learning, so a nanny to help facilitate with the online schooling, and even potentially running the entire school program for their children at home. So can we help with that, and what does that look like? And what are the costs involved, I guess, was part of the question too.
Yeah, I mean, basically, those types of nannies are our target nannies. A lot of our nannies have a qualification behind them. So ECE, Montessori, some have Bachelor's of Education, some have special needs certificates. And so they are certainly our targets, and they are the nannies who are being scooped up very quickly at the moment. What we're finding is that with their qualification, they are seeking a higher rate, and we're seeing rates anywhere between $25 to $35 an hour, I would say, and that's a gross rate.
Right.
So the taxes come out of that. Yeah.
Okay.
Yeah.
Yeah, I think that's great. Okay, well, I think it's about 10 to 12. Well, I'm in BC. I don't know if I said that. It's about 10 to 12 here. So I think that covers most of the questions that were sent in, or the ones that Kate and Lisa and I get all the time. So I think we'll just wrap up with just a couple of thoughts from Lisa, Kate, and myself. And hopefully we answered everyone's questions. I will say, if anyone has any more questions, you can email any one of us. So our emails are just our names at nanniesoncall.com. So Michelle, Lisa, or Kate at nanniesoncall.com. Feel free to ask us any questions. We're happy to answer them and try and help you as much as we can. We've learned a lot in the last 4 months. We've had to adapt a lot in the last 4 months. I think what I've seen the most of is is families really trying to do the right thing and do the right thing by their nannies and pay them, even though a lot of these families were in difficult situations where they were laid off or didn't have work anymore. So they had to lay their nannies off, but they were very upset or they felt bad about laying their nannies off. So I think we've just seen a lot of compassion. And really the important thing is just to be honest and upfront and open with the nannies right now, and the nanny being open and upfront with the families and just trying to have that relationship so that you can have a long-term relationship. It's hard. It's very hard to find good people and good people that fit with your family. So once you find them, I would really suggest hanging on to them any way you can. Yeah. Lisa?
Yeah, and that actually kind of goes in line with what I wanted to say too. Again, communication is key. And I mean, it's always a key important part of any nanny family relationship, but I think the successful ones during COVID are the ones that are going to be checking in with their nanny, making sure that you're talking about things that maybe you're scared about or that you're not happy with, you know, how the home is running or whatever it is. Make sure that you're checking in with your nanny constantly and working through any concerns. And those are the relationships that are going to last. Yeah.
Okay. Kate?
Yeah, I mean, I think it's important to remember that everybody is scared. Everybody's scared about the virus. It's such an unknown. The parents are scared. The kids are scared. The nannies are scared. And I think I think the feeling sometimes is that the nannies are not following the rules, but they are absolutely 100% following the rules. I feel like if you hire the right person and there's open communication, everything will be fine. I think really and truly, it's just a matter of trust, and trust is a two-way street. Trust is such a big part of the relationship anyway, when you're hiring a nanny.
Yeah. And just to remember, the nannies, although they're your employees, are people as well. They're people who have bills to pay and concerns with family, or they have their own kids, or they're taking care of parents. So they have bills to pay. So when you think about only hiring someone for 4 hours a day or cutting their work to 2 times a week, it really can affect them. And just to keep that in mind as well. Yeah. Okay. Well, thank you, everyone. Thank you for those of you who joined us live. I will put this together as soon as Zoom makes it available for me to send out a link, and I'll send it to everyone. Of course, if you have any other questions, we'd love to help you. If you need a nanny, we're here for you. If you have questions, we're here as well, and hopefully we'll be in touch soon. Thanks, Lisa and Kate, for all your answers and your expertise.
My pleasure.
My pleasure. Thanks.
Thank you, everyone. Have a good day.
Bye-bye.
Bye.